Hello, everyone, and welcome again to Age-Friendly Chelmsford. And this is Debbie Siriani. I'm the director of the Senior Center and also the co-chair of the Age-Friendly Implementation Committee with Fred Brousseau in town. And I'm here with my lovely co-host.
Hi, Debbie.
How are you, Lisa?
Doing great.
Lisa Maroney, who's the Business Development Director in town, and also on the Age-Friendly Implementation Committee from the very beginning, and helping us with a lot of civic engagement, also with some of the dementia-friendly practices we've been, initiatives we've been working on in town. And also today, our wonderful guest is Darcy Beall from the Board of Health.
Hi.
She's the public health nurse. Great to have you, Darcy.
Thank you. Thanks for having me. I appreciate it.
Oh, it's great to have you. So you are, let's see, BSN is what?
Bachelor's of Science in Nursing.
And an RN.
Yep, so that's my license.
So that's your license and your background, and you're here representing the health department. Now, I have to say, talk about age-friendly, the fall fair. If you hadn't been to the fall fair, it was amazing. That was run by the health department.
Yes. So a little backstory on how we started doing the fall fair was we used to have health fairs, once a year, and typically it would be at the senior center, and we would have groups from all over the community representing different health topics. So we'd have, Lowell General, we'd have other doctors' offices, and they were great, and they got a lot of information out to people, but we didn't get a lot of people to come to those, and it was a lot of work. So we tried to think of a way where we can get a lot of people to one of our fairs and kind of sprinkle in the health information in there. So
Sneak it right in.
Sneak it right in. And it worked. And
yes, it did.
We made it more kid-friendly, so people are more than welcome to bring their kids. We still have the community partners that come in and, like dentist office or chiropractors and stuff like that. And it also came out because after COVID, we really wanted the community to come back together and be really social again. So last year was our first year doing it. It was a great success. It brought the community together. It gave us all like a nice camaraderie that we were missing through the pandemic. So
it so did. And
Yeah.
it had the feel of like a July 3rd festival. It was so busy.
Yeah.
I was surprised.
Yeah.
It was wonderful.
It's hard to estimate how many people, but I think it was at least 2,000 to 3,000 if you were to group everyone in. It was huge.
And what were
So
some
much
of the
fun.
groups that came?
So we had a dentist office there. We had, of course, the diversity committee was there. We had Hannaford's, who was a great sponsor of ours. They helped, show people what are some healthy snacks that you can eat and what, good ways to be healthy. And Senior Center was there.
You had the princesses there.
The princesses were there. So that was a huge
That was
draw.
really fun.
It's
you
a
guys had a
huge
lot
draw.
of fun. The touch
Yeah.
a truck.
Touch a truck. We
stuff.
had face painter, balloon
Yes.
maker.
Yeah.
And then Mahoney's donated pumpkins for us, so the children were able to decorate like a small little pumpkin to take home. And Farmer Dave's gave us some apples and water from Pepsi. So we had just a huge amount of support from a lot of the local community businesses and some partnership. It was awesome. It was so good.
I love that you're making a healthy life part of the culture of the town, something that children and older people and everyone in between feel like is important, and that everybody can be part of and also enjoy each other, and that
Exactly.
that being a community is actually part of being healthy.
Yeah, it's great for your mental health. Having that social network is almost as important as having a network of physicians and nurses that take care of you.
Well, I appreciated at the senior center, we brought what was called a happy to chat bench. And I guess at some of the schools, I stole it off the internet, so it wasn't my idea, but they have like buddy benches at some of the schools now. And so the happy to chat bench was just a way for people to come and sit and, have a place to to rest if they needed to, but also know that there was always someone they could talk to. And of course, I'm kind of naturally prone to, just being able to chat with anybody.
Conversation specialist.
We're like, wow, you're good at that, Deb. My mother would agree. So, and then we had these little chat cards, and they were great. And it just said conversations you can have with your grandparents. And they would have little questions like, what is your favorite meal of all time that you would, love to have? And they just started talking with each other and with us, and people of all ages sat and we were like, what would be your ideal place to go on vacation? And it just opened up all kinds of conversations that we wouldn't have had with people, and I think they really enjoyed it. I did. I certainly did.
Well, it sounds
It was
fantastic.
a good time.
Yeah.
So I thank you for creating that opportunity for people in the community.
We'll see you next year. We'll be doing it next year.
We will bring the chat bench and new questions.
You may have to bring 2 benches.
Yeah.
2 benches. Oh dear. That's a lot of talking.
Oh my gosh. Wow.
So I'm also very impressed with we've been partnering for quite a while at the Senior Center with you. You regularly come for our Veterans Breakfast. Once a month you come to do blood pressure for seniors.
I do. That has been a great way to get people interested and just kind of keep blood pressure in the back of their head. Blood pressure is called the silent killer because we really don't have any symptoms of it until something goes wrong. And then it's chaos. So we really want to, monitoring your blood pressure is just a great way to stay healthy. So the easiest way I can do that is come to the people, right? I'm not going to expect people to come into my office and get their blood pressure taken. While I do have some of that, it's so much easier for me to come to them. So I always look for opportunities where I can kind of just plop down my blood pressure cuff and a couple of volunteers. And we've gotten some regulars that haven't been monitoring their blood pressure until the Veterans Breakfast. So thanks for inviting me and letting me come in.
That's great to have you.
Yeah.
Do you have a regular time at your offices too?
I do. Not a lot of people take me up on it, but it's the first Thursday of the
That's
month.
because you're not feeding them a full breakfast like I do.
I don't have food to offer. But, and
We'll have to change
could
that.
offer
Get some
food.
donuts over there. Healthy.
Healthy snacks.
Healthy snacks. But yeah, I have a couple people that do come in and we work, and that way we get them twice a month. So it's kind of more of a frequent monitoring that they can bring back to their doctor and say, hey, this is what my blood pressure's been trending over time for a little while, and it can help influence some medical decisions, whether they should start on a medication or change medication or whatever. So it's a good thing.
Yeah.
It's a good thing.
And it's just building that relationship again too with people in the community,
For sure.
so they know that they can trust us as health officials, as public officials, if they need something. I think that was a great value when COVID came along, when they were looking for advice or needed help, even in emergency situations. I'm also, please call 911 instead of the senior center. No, but I mean in like when we have shelters or such, that they feel like they can call and call on us.
If things get stressful and they're comfortable talking with you, they know you, they come to the center all the time, they meet you all the time. So it's just added network to build the livable community for all ages, right?
Which is all what Age Friendly is about. It really is.
Yeah. Yeah.
So let's see, what else?
You want to talk about flu?
All right. We're
about
having
the
a
flu.
flu clinic this coming week
We are.
Yeah.
at the Senior Center.
Yep, it's our big public clinic. It's this Thursday, October 12th from 3:30 to 7. We reserve the first hour from 3:30 to 4:30 for those over 65, just to keep the crowds kind of, give them their own time, right?
Which is very helpful.
It's really helpful, and they really appreciate it. Of course, walk-ins are welcome, but it's always easier if you are able to schedule ahead of time, just pre-register. It makes the line go a little bit quicker, but if you can't pre-register, we'll take you as a walk-in.
Do they need insurance information? Or
Yes, bring insurance information. Short sleeves are also easier. I mean, we're getting a little chillier. Everyone's going to be bundled up, but if they have a short sleeve on, it's a lot easier to access that arm.
Layers.
Layers. We offer the high dose for those 65 and older. And unfortunately, we can only offer the vaccine for 19 and older.
Okay.
Yeah, anyone under 19 goes through a special state program where the state actually pays for the vaccine. And we were not allocated a lot of vaccine for that, so.
Okay.
I've been seeing the flu shot advertised since August.
Yeah.
I mean, is that just a volume situation why they start so
Early?
soon? Yeah.
I know
yeah.
certain job requirements really want it done early.
Okay.
I personally think September, October is the perfect time to get it because your immunity wanes after a while, and you really want to have that coverage for January and February. It kind of goes down after that.
Yeah.
So yeah, this is the perfect time to get your flu shot.
I got mine done at my doctor's office.
Mhm.
And what's your advice for folks under 19 generally to get it through your doctor's office? Or?
I know the Chelmsford school system is going to have a flu day for middle and high school. Elementary, you really should be going to your primary doctor, your pediatrician for that. It's just, and a lot of times they have clinics in their offices that will, quickly immunize the kids of that age group. But yeah, I know the high school and the middle schools are going to be doing it in school this year. There should have been an email that went out.
And speaking of immunizations and vaccines, so they were basically encouraging for COVID vaccines for us to wait a little bit.
Yes.
Was my so they were waiting until basically now, and it's all ready. And I know somebody from the senior center was like, "Oh, I'm going to go over now because they're starting to run out." Like, what's the scoop on?
They're not going to run out.
all that?
It's kind of like a they get shipments of it, and then they use up the shipments, and then they have to wait for more shipments. So it's not like a huge sum all at once. It kind of not trickles in, but it comes in waves.
Okay.
Right. And what's interesting about this new COVID shot, we're not really looking at it as a booster per se, because it's a monovalent, which means there's only one strain of COVID in there. So it's built off of the strain of Omicron. So we have like 12 Omicron strains right now circulating. But it's really the Omicron umbrella, I should say, is kind of where this newest vaccine's from. And it's Moderna, Pfizer, and Novavax. Those are the three that are available in the US right now. They've been all approved and they're good to go. So the CDC is saying, even if you haven't been vaccinated, most likely all you need is one monovalent, which is the newest, to give you some good coverage for this winter.
And are they basically going to have it for like once a year now, or do they really?
I wouldn't be
know
surprised.
What's gonna happen
I think it's going to turn into somewhat of a flu thing, where the strain's going to keep mutating and changing a little bit, and we're just going to keep tweaking it. I think that's my guess.
Okay.
And then that's what I've heard as well. I at one point I heard last year that they were going to combine the flu and the COVID shot, and they haven't done that this year. Maybe in the following years, that's one shot for both. But we have yet to see.
And is there advice about, like, if you had your flu shot, should you wait a couple of weeks before your COVID, or is there anything like that that's counterindicated to be able to have together?
It's perfectly safe to get them both at the same time. It's completely up to you, of course. I would rather wait and get them separately, because if I had a reaction to one shot, I'd want to know which shot it was. But it's 100%, you're fine to get both at the same time. There's no medical reason why you can't get it at the same time. So if there's no other time for you to go and get these two shots, get them done at the same day.
Yeah. And I haven't heard any buzz about like anybody having bad reactions really to
No,
vaccinations.
We've all either been exposed, been immunized, or had COVID. So that's kind of just how it works, is we are all getting our own immunity to it, whether it be natural immunity of getting COVID or vaccine immunity. And I think that's just the way it's just gonna be from now on. It's kind of how flu was when it first came out. When it was a new virus, it still mutates, and that's why we have the new flu shot every year. They always pick and, kind of tweak it a little bit. This flu shot this year has 4 variants of flu in it. So it's kind of like a broad coverage of all the different flu.
You've got to
A's and
relearn your
B's.
things every.
Yeah, you really do.
You just have to keep on learning
Really do.
everything.
Science.
But it's
A lot of
important because, flu is still a huge problem every year, and it can land a lot of people in the hospital. And it's not necessarily because they got the flu and they got sick and they had to go to the hospital, but they get the flu and it usually develops into a pneumonia where they get hospitalized for it. Yeah.
I want to ask this question. I don't know if you know the answer, though, so I don't want to. But I heard it was on TV, so it must be true. No. But they said the COVID was still in the 5 top killers.
I don't know. I don't have the answer.
Never mind. We'll
I don't
look
have
that
the
up
answer.
before we go. In U.S. right now, and I was like shocked.
I
because
know
of
the
that.
hospitalizations. We've
true.
had an uptick.
Let's
for sure.
just Google it right now.
We've definitely had an uptick recently. I've seen it come across my desk. It's hard to measure that though because so many people are taking home tests right now. So the home tests don't get reported to the state. They don't get reported to the government. No one knows but the person that took the test, right? So a lot of those numbers just kind of go under the radar. We don't know. But from the people that go and get tested for it, maybe they're sick enough to go to their doctor's office and they get tested. We get those reports in, and yes, I have seen an uptick in cases for sure.
Yeah.
Yeah.
Okay.
Which actually is a great segue into testing because a lot of people call our office and ask about COVID tests.
Yes, ours too. And we ran out at the senior center.
Exactly. There was a time where we had so many tests and we couldn't get rid of them. We were handing them out like candy. And then we ran out, which was great.
Yep.
And then the state said, okay, well, the pandemic is, the government funding for the pandemic is done. So local boards of health can purchase the tests if you want to supply them to your residents, which of course we were like, yeah, sign us up. Except the caveat is like minimum bulk order was huge. We couldn't afford it. So we kind of were like, okay, I'm sorry, we don't have any tests when everyone would call in. However, just Friday, I got the word that the state is going to be supplying us with more tests again for free.
Great.
Very exciting. So I ordered a bunch of tests. We're going to be getting them within a week or so. So if anyone's needing tests, we're going to give some to the senior center, to the library, and to the town hall. So we will have tests again.
You heard it here first.
Just in time.
Oh my
Call
gosh.
first before you.
Yep.
Oh my goch.
So
What number should they call? 978.
call the
Two-
senior center,
yes.
978-251-0533.
Or you can call the Board of Health at 978-250-5241.
Don't call business development.
Don't call Lisa.
Don't
call
call her.
business
Don't call her.
development.
Don't call her.
Well, you could, and I'll get one of these fine ladies
She'll
to
be
help,
running
but I wouldn't know.
You have a
Just
us on
saying.
speed dial, right?
Yes.
So we were going to talk about RSV.
Yeah, it's RSV season as well. If it's not COVID flu, it's RSV. So RSV is a virus that we usually see uptick in the winter times, starting fall. It's a respiratory virus, usually common cold symptoms, right? Most people can get over it pretty quickly, no big deal. However, people with asthma, heart disease, diabetes, if they're elderly, if they're very, very young, can get really, really sick from it. It sends a lot of people to the hospital. This virus will actually turn more into a lower respiratory infection, which can be pretty serious for people, especially with breathing problems that might already exist. So this year, the CDC and the FDA approved 2 vaccines for RSV. They are for people 60 and older. And they are a great tool that we can use in our toolbox to try to keep people out of the hospital during this time. And then they also approved one of the vaccines for pregnant women, which is fascinating to me because what happens is between, I think, 36 and 42 weeks, if the mother gets this vaccine, she'll carry the immunity to her unborn baby, and the baby will be protected for the first 6 months of their life, which is awesome because that's their most fragile time, So it's really cool what's coming around, in the science world and what they're coming up with. But yeah, the RSV vaccine is out there. I highly recommend people get it. We can't offer it at the local level, but any pharmacy should have it.
Especially if you have some kind of
100%.
lung COPD maybe or asthma, things
For
like
sure.
that.
For sure.
Excellent.
Yeah.
Great. And to probably call your doctor and ask about it would be the
Yep.
best advice.
Yep. And
It seems like those, like COVID, flu, and RSV all sound like they'd have similar symptoms. You'd just be like wondering, like,
what do I have? Yeah, exactly.
Like, how do you
Yeah.
It is, and I think
stay inside?
basically that's perfect. I mean, you just kind of take that general information for people is if you feel sick, stay home. Wash your hands when you go out. Don't, if you're coughing and hacking all over the place, try to catch your cough with your elbow like we used to do at school, or take a tissue and cough into the tissue. I mean, we just have to try to limit our spreading of this to the best of our ability. And vaccine and hand hygiene and cough etiquette are the ways to do it, for sure. Of course, eating healthy.
My kids always go, elbow, Mom, elbow. Because we didn't grow up going like this.
No,
we grew up
right. It's a
Yeah,
habit.
like, not in the hands, no.
That's true. Absolutely.
Yeah.
You know,
and it
kids
makes
always
sense.
know so much more than parents.
Oh,
so,
yeah.
You know.
Too funny.
Can't get away
So
with
there
much.
were some programs with the high school kids you are going to be doing soon too.
Tonight, yes. So tonight, probably by the time this airs, it's a little too late, but we anticipate having more programs like this. Again, we're getting back to that mental health is health focus, especially post-pandemic. I mean, we're all hurting, and especially our teens and tweens. So we found a speaker. He's pretty famous in the speaker world. His name is John Madelman. He's a psychologist and a presenter, and he does about a 2-hour talk on understanding your teen and tween, and maybe what are they going through? What does their anxiety look like? How can you help them? What are some tools you can use to get them to communicate with you? So that's tonight at the PAC at 6:30 to 8:30, and we rented out the huge auditorium because there's just so many people that could benefit from this talk.
Absolutely.
Yeah. So, but we're going to have more. We're going to have more of these presentations and stuff. Best way to do it is like us on Facebook, sign up for our email list, check out the website, the Chelmsford MA website.
And your Facebook is Chelmsford BOH,
Yep.
right?
Yep. That's our
Chelmsford.
primary site, and then we have Chelmsford Board of Health, which is our page.
Oh, okay.
We try to post to both. It's a little
Yeah.
confusing,
Okay.
but yeah.
I think I've
Either one
seen
of those.
both, but
Yeah.
yeah.
Either one
You're
of
always
those.
you have some really, really topic-centric workshops that are really important right now. So
Yeah.
it'd be great to follow
We have a
along.
lot of great things going on.
And when I saw the teens and tweens, for some reason I thought it was directed towards the teens and tweens, not the parents. I think I was just reading it too
Oh.
quickly because I just saw teens and tweens,
Yeah,
right?
yeah.
So I
No,
didn't realize
I
it
mean,
was for
I'm
the
sure
parents.
it's appropriate for teens to be there, but it's really geared for caregivers or people who interact with teens and tweens.
And tweens are like 10 years
10
old to
yeah, 10 to 12-ish.
9 to 12,
Yeah,
and then
I'd say middle
13 and
school.
up.
Yeah.
And we're also doing the behavioral health mental wellness workshops twice at the senior center, twice per month. So right now, today, are the anxious thoughts. That's the anxious thoughts one. And you're starting, and then next, in the next 2 weeks, we'll be having one on, is it sadness or depression? So check out the newsletter or the website or the Facebook page or call me.
Or call.
And you're also doing a regular workshop with the Board of Health about
Yeah.
anxiety and depression. I saw
Yes.
at the CCA.
It is at the CCA in the cabaret room. We have a licensed social worker who's going to come. We're going to do a support group once monthly. And it's held by Marissa Cameron. She is one of our human service support people in the office. So we're trying to get that up and running. I think that starts pretty soon.
Yeah.
Don't quote me.
I think that's excellent.
Yeah, I do too.
That's geared toward adults, 18 and over
Yep.
right now?
Yep.
Okay, good.
Yep. It's anonymous. You can register just so we know what to expect, but it's not at all required to register. When you arrive, you will have like a set of ground rules of keeping, things private that are supposed to be private and being respectful to everyone who's there. But they're going to be able to walk away with some great tips on how to handle some of the anxiety and depression problems that is really a problem everywhere. So we have this service called Care Solace, and it's a referral service where if someone's having some issues and would like to find some support or a practitioner maybe to talk to, they can call up the 1-800 number or go on their website or text or call us. There's so many avenues to reach them, but basically it's a referral service. They'll work with you on your insurance, on your needs, the type of person you want to see, and they'll try to get you an appointment. And it cuts tons of time off from that whole process, which can be pretty lengthy.
Yes.
So we basically, we can see, you know, of the people who call Care Solace, like what were their primary complaints and what were their issues, and depression and anxiety were number 1 and number 2. So we really wanted to focus in on what can we do to help what's bothering our community most.
And I've used
That's
that
it.
resource too, and it's very helpful.
Have you?
And also before, with the interface, we used to have that.
Project Interface.
And it cut through a lot of red tape of trying to find who was the right schedule and the right insurance and everything.
100%.
And it was just so helpful for my family.
And they're
so
24/7.
I would really encourage it.
Yep. Yeah, they're awesome.
Well, thank you so much. Your Board of Health are rocking it.
Thank you.
I'm just so happy with all what you're doing.
Thank you.
And making this town, this community, more age-friendly and more people-friendly, more
Thank you.
healthy.
Thank you.
So,
Thanks for having me. I appreciate it.
Thanks.
It's great to have you on. Thanks for finding the time, and you know, please come back again in the spring.
Absolutely.
See what else is going on.
Absolutely.
Yeah.
And we're signing off. Thanks so much. Have a great day, everybody.